Hi, welcome to another episode of Youth Diary. Skeletal system is the supportive system for the body. It gives shape and mobility to our body. And to talk more about it, we have Dr. Raj Mohan with us. He is an orthopedic and reconstructive surgeon at Rene Medicity, Palarivattam. Hello, doctor. Welcome to our show. Doctor, can you just explain what is a reconstructive surgery of joint?
Joint normally means that the place where two bones meet. The ends of the bones which are meeting are covered with a smooth surface called cartilage, and that gives a smooth gliding movement of the joint. But in degeneration, this smooth articular cartilage is lost, and in that place you get a roughened bone. So when the joint moves, these roughened bones rub against each other and causes pain. So in such severe conditions, it cannot be cured with just medicines, and we may need a joint reconstruction surgery. In joint reconstruction surgery, we remove that damaged layer from both sides of the bone, and in that place we put an artificial layer. And then the movement occurs between the smooth artificial layers and the pain disappears. This is what is briefly described as a joint reconstruction or joint replacement surgery.
What is the incidence of a degenerative disease of joints in our society?
Joint degenerative disease mainly type like mild, moderate and severe. Mild occurs in almost 80% of the patients above the age of 35 years. And moderate and severe depends on their obesity, their nature of job. And mostly it's mild disease that is occurs in 80% of the cases. Joints commonly involved in the joint degenerative disease in our body are those joints which are more actively involved in our day-to-day activities. For example, the neck or the cervical spine. It's mostly involved in people who are working in the computers, so that can lead to a degeneration of the cervical spine called cervical spondylosis. And then comes the lumbar spine or the back. Again, it is mostly involved in people involved in sedentary jobs who sit for long hours in faulty postures.
Like drivers?
Like drivers and even clerks and those who are doing the sitting job. They don't maintain a proper posture. That can lead to degeneration of the back. Then comes the knees. It's again seen in people who are obese, overweight, and those who have to walk along, who have to walk more staircase, more stress to the knee, causes the osteoarthritis of the knees. So most commonly it's the neck, back and the knees.
Okay. So what are the symptoms of this joint degeneration, doctor?
Again, it depends on the joint involved, but initial stage you get pain only in the extremes of the movement of the particular joint. For example, if the cervical spine is involved, you notice when you have to turn for doing a reverse or when you look up, you will get some pain. That is the initial starting stage. But as the disease progresses, the pain will be there even during rest, and it can come down your arms. And again the back also. Initially the pain will be there only when you stoop down, bend down and all. And later when it is severe, it will be persistent. The knee also, the knee degeneration, the pain you get initially only while getting up from the sitting position or when you climb stairs or climb downstairs. Initially these are the symptoms, early symptoms.
Doctor, along with this pain, will there be any inflammation or edema or swelling of the joints?
As I mentioned, when the rough bones rub against each other, it's the body's reaction to produce fluid around the joint, which is we call as effusion. So when damaged joints move, you get a fluid collection around the joint. It's called effusion.